Welcome to Chalkwalks. Hi, I'd like to discuss a couple of cases of Stranguria in cats, and this often is around the syndrome of urethral obstruction in male cats. This first case is a 1-year-old domestic medium hair cat, male, castrated, and over 6 kilograms. He had a history of hematuria and stranguria, and also showed increased grooming around the perineal area, something you can see quite commonly in these animals early on. At the time he was examined, he had a bladder the size of a tennis ball and was 5% dehydrated. You see the results there. The key and actually encouraging findings were that BUN and creatinine were only mildly elevated. This was picked up fairly early. So they gave methadone, which is we'll just write it over here, a mu opioid for pain management and sedation during radiographs, and also then sat him in a cage and gave the benzodiazepine, midazolam, to see if it was the cat was simply anxious and not willing to urinate in a cage, which is very common in cats. You put them in a cage in a hospital, and depending on what else they have around them, they're stressed out about being out of their element, and they may not urinate even if they're completely normal. 2 hours later, that didn't seem to help, so they passed the catheter and initiated, and of course all the while we're initiating fluids, rehydrating over 12 hours. So that would be approximately 300 milliliters plus rehydration if we multiply 6.3 times 0.0 times 50, essentially 50 milliliters per kilogram, we get 315 to be exact. So then was put back on maintenance. A very important thing about this intensive fluid therapy is to weigh the animal, and they were doing it every 8 hours as a way of establishing a baseline, and then looking to see if the animal might be under or over hydrated at that point. Of course, key once you have a catheter in is following urine output. Do your ins and outs, so to speak. And at some point, you're going to find, usually post-obstruction, that there may be a post-obstructive diuresis. But let's say this was all managed well. I want to focus on another aspect that can happen after passing a catheter and all this trauma to the urethras, that the cat may have a a urethral sphincter spasm, and that may be a reason for them to not be successfully able to urinate. This would be after pulling the catheter, after removing the catheter. And we use a drug, or have used drugs, in the class of alpha antagonists. And prazosin is an alpha-1 antagonist. And now why do we do this? Well, the urethral sphincter has an alpha-1 receptor, and this is, by blocking this, we can lead to reduced tone in that, and the tone is dominant. The sympathetic tone is dominant on the urethral sphincter. And if there's pain, and you can imagine there's increased sympathetic tone even beyond that, and so we're blocking that. The other possibility, and that's probably not likely in this case, is that the bladder was too large, can become too large and atonic. In those situations, if you have an atonic bladder in cats like this, you may need to use or try using a drug called bethanechol. Bethanechol is a cholinergic, muscarinic cholinergic drug, and it leads to contraction of the bladder itself. Okay, let's turn to our second case. This is going to be a slightly different scenario. This is a 2-year-old male castrated domestic long-hair cat, also around 6 kilograms, and it also had a history, in this case, of a long-term, several weeks of difficult urination, that is Stranguria. It's treated by a referring vet with antibiotics, which showed oral antibiotics, probably something like a aminopenicillin, leading to improvement. Later on, it was treated with sulfovicin, which led to improvement. And then 3 days ago, presented again due to increased scooting and stranguria. And this time, in this case, a catheter could not be passed, and so the referring vet conducted a cystotomy because they could not pass the catheter. Now, we're seeing the animal a couple days later being presented. It was just presented yesterday, where they suspected that there might have been a urethral tear during the original attempts to pass the catheter. So that's the scenario we're dealing with. And the surgeons conducted a transpubic urethrotomy, and we're now dealing with the cat. So where is this cat metabolically? It's got an elevated BUN and creatinine at this point, and it's also hypokalemic. So that actually, the low potassium would suggest that this cat has been inappetent for quite some period of time, because you usually expect an acute blockage of the kidneys that potassium would be elevated. So we're not going to go into that we probably need to continue fluid therapy, follow the catheterization, follow the urine output via the catheter, and address that very aggressively, and then monitor as the animal is now post-obstructive at its potassium status. What I'd like to talk about are the various ways, of course, that we need to handle an animal like this, even after such a surgery. During surgery, the animal got the injectable anesthetic propofol, methadone, opioid agonist, and also buprenorphine for more chronic pain management. It's also a mu agonist, opioid agonist, and it has characteristics of an agonist slash partial agonist, I should say, although it's very potent and very effective in its use with cats. Potent in the sense that the concentration, remember, potency is that it takes a smaller concentration to achieve the same, to achieve its maximal effect. But in this case, the maximal effect is, compared to morphine, let's say, is less with regards to pain management. It's also less with regards to side effects like respiratory depression. The cat was given ampicillin and dexmedetomidine, so also to sedate it, acepromazine. And I want to point out here that, and these are all at different times, acepromazine has alpha-1 and alpha-2 antagonistic activity. And so, just like we discussed before in the previous case, the prazosin, which is alpha-1 antagonist, this acepromazine can both lead to urethral relaxation as well as sedation. Imidazolam, of course, is also sedation. So there's a cat with a lot of other problems. Why would you feel that there could still be a problem with the urethral sphincter? Well, the urethral sphincter, the urethrotomy is post-urethral sphincter. and so there could still be urethral spasm due to the traumatic attempts to catheterize the animal, as we saw in the first case.